so much for allowing us to join.
Yes, thank you. We're so glad to have you.
We're so excited. This is cool. Thank you.
Yeah, for sure. Okay, it looks like we are live. Lauren, is that correct?
Yep, give me 1 second
So much for allowing us to join.
Paste this over.
To turn off this. That's fine. Okay. All right. Well, good morning again to all of our viewers out there. Thank you for joining us. We are thrilled to have another awesome presentation this morning from a couple of folks that work for Gateway Community College. So I'm going to introduce our main speaker, who is doing the program description and some fun details on the medical assisting program. Just a little bit about the presentation. You might be the first person that the patient meets in a medical office. Not only is that relationship building important, but your ability to be calm and clear under pressure is necessary. Don't like working with people and helping them feel better? This isn't the career for you. Compassion and caring, along with an attention to detail, a willingness to collect samples, and a desire to assist doctors is required in this career. Interested? Then join us and find out what it's like to work with Mayo Clinic, Banner Health, Honor Health, or one of our other partners. So our presenter today is Miss Angie Bowman. She's a senior medical assisting instructor. And during her 4-year tenure, she has supported both Block 1 and 2, administrative and clinical medical assisting. Before this role, she was a medical assistant with over 13 years of experience. Angie has worked in urgent care, family medicine, and correctional health. And in her spare time, she enjoys cooking and nature walks, with her family and their dog Chance. So thank you for joining us, Angie. Go ahead and take the stage.
Thank you so much. I appreciate the introduction. Well, I'm really excited to be here and to share about our program, our medical assistant program at Gateway Community College. I want to talk a little bit about the program and also to just kind of go a little bit more detail into the introduction. You know, the details, the required skills that you're going to need to be a medical assistant. And Delcy mentioned that you have to have, be able to stay cool, calm, and collective, right, during an emergency, because as medical assistants, you're going to be working family practice, urgent care, pediatrics. Patients come in because they're sick or maybe they need a physical, but they also come in because of emergencies. And so being able to stay calm during an emergency is going to be one of the most important skills that a medical assistant can have. And so, you see a little bit of everything in the medical field. And as a medical assistant, you certainly are part of patient care as well, and in emergencies. So, and just to kind of tell you a little bit about the program and how we prepare you to join the workforce, to join the medical field. So we do everything from the beginning all the way to the end of the program. So front office, back office, and externship. So that includes us putting you into one of our community partners. And so as Delcy mentioned, we have partners like Phoenix Children's Hospital, Banner Health. And so you get to be a student and practice the skills that you've learned in these offices. And so I'm just gonna go ahead and continue on with the presentation here. And so these are just our instructors that are part of the team. Myself, Angelica Bowman, and Delcy did a really good job at talking about my experience. But if you choose to join our program, these are going to be the faces that you're going to be seeing. So we have 2 other instructors. We have an evening instructor and another day instructor as well. So we do have an evening program for those whose schedule would match better to join an evening program as well. I teach the day program. And so the overall purpose of the program is to prepare you for an entry-level medical assistance, right? So you can, we're going to provide you with the foundation so that you can go on and build onto that. And now when I say entry level, means that you can, you're going to be able to work in front, back office. You're going to be able to assist the provider in certain procedures. There's a lot of times that we've performed small in-office surgeries. So you'll be able to assist the provider in doing that, drawing blood, giving injections, doing vitals, and many other things that I will share with you a little bit more as I go along with the presentation. One of the neat things about our program is that our students can, at the end of the program, when they successfully completed, they can sit for certification. So you can become either a certified or registered medical assistant. Okay, and our program is broken into 3 blocks. The first block is going to focus on introduction to healthcare. So you're going to learn all like your medical terminology, administrative functions. You're going to learn also anatomy, physiology, and pathology, right? It's going to be really important for you to have that foundation, right, as an entry-level medical assistant, so that you can understand and be able to communicate with other healthcare professionals. Then when you move on to block 2, you go on into the clinical aspects. So you're going to learn all of the phlebotomy, right? So drawing blood from someone's vein, from a capillary, so their fingers. You're going to learn how to give injections. You're going to learn how to take a height, weight, blood pressure. So everything that you can think of. If you've ever been to a doctor and you've been a patient, that person who calls you back, takes your chief complaint. That's a term that's really the reason why you're there. That's a medical assistant, right? And so he or she is going to be collecting this data and then entering into the medical record. And so block 2 focuses on the back office portion of it. And then block 3 is our externship. So this is where you get to go to our partners, to Banner Health or to a children's hospital, and get to practice everything that you learn in the classroom. You get to practice in real life with real patients and work with doctors, nurse practitioners, physician's assistants, other medical assistants, and other healthcare professionals. Right. So once, and the goal, of course, I'm going to go back one more slide. The goal is that once you're done with the externship, you've completed the program, you can go on and get a job, right? And so a lot of one of the cool things is that with our partners, a lot of our students actually end up working at the site that they did their externship. They did such a great job. They impressed the employer, the clinic, the doctor, that they decide to keep them. And so a lot of times our students, even before they're done or they're done with externship, they already have a job offer, which is really neat. And here are some pictures of the facility. So right now, as we are now, we're on online, right? On a computer, on a video camera. It's historically, our program has been an in-person program, but because of the current situations, we had to modify our program. So we're doing a hybrid. We're doing a lot of the lecture and theory is being done online, live, like we're doing now. And the skills are then, the students will come into the campus and then they get to practice the skills. This may change the next couple months, or whenever things start to change a little bit more, then we're going to be back on campus 100% of the time. But so this is our classroom. This is where you're going to be doing most of your theory, right? The lectures are going to occur here in the classroom. And then we have our lab. So this is the MA lab. We try to mimic the lab so that it looks like a clinic, right? Or an office, a patient exam room, right? So we have all of the equipment that you see there, like the exam table, the otoscopes, all of those things are things that you will see in a doctor's office. The equipment here that you see on the far right-hand side, these are called autoclaves. These machines are used to sterilize medical equipment, medical and surgical instruments. And so these are the same type of equipment, machines that you will be working with as a medical assistant. And so we train you how to use those so that when you go out, you are very familiar with how they work. Also with the phlebotomy, I'm going to go back to the lab here. With phlebotomy, we teach you about phlebotomy. We're going to read about it. We're going to talk about it, and then you get to practice it. So before you practice on live people, we have these dummy arms here with fake blood. And so you get to practice the technique, the skill, and you actually get blood on tubes. So once you've been checked off by an instructor, myself, then you get to move on to real people. So the things that you learn in the classroom, you're going to practice it with each other. So you have live, simulation patients that you're going to be learning on, which is each other. And I just wanted to add a couple pictures, things that we do throughout the semester. We do get to go and help out the community as a team. The girls here on the left-hand side, we were at Verado Elementary. We got to help them last year with their health screening. So they learned how to do blood pressures, height, weights, vision exams. And so they're just, practicing on each other here. But this is at Verado Elementary last year. I want to say it was around September. And then on the other side here, on the right-hand side, we have our students. We at the end of the one of the courses, they have a big final, and they have to do a presentation, and they get really creative, really, they get really involved in what they're doing. And so one of the final presentations is they have to, create a PowerPoint and a lecture on a subject, like on a body system that they've learned. They're assigned, and so they get to, they decided to come in dressed as the skeletal system and the muscle system, which I thought was really neat. So we have fun, we're learning, we're acquiring skills for your future, but at the same time, we're having a good time. Here are the girls again. So on the right, it's Everard Elementary, and then on the left-hand side, the girls, we went to Palm Valley Elementary and helped with their health screenings. The machine that you see that they're using here, that's a hearing screening machine. So we use this for the students to see if there's any deficiency in their hearing. And so this is something typical that you would see at the schools and also at the doctor's office as well. And they look different. These are a little older machines, but there are different, variations of this type of machine. But overall, it's a hearing screening. And this is in our lab. This is a day that we were learning about the ears, nose, and throat. And so they got to see what the tympanic membrane looks, right? And again, so you get to learn about the skills that you're going to be performing, and then you get to practice it on each other. And that's how you get to learn and acquire these skills. On the left-hand side, we do a lot of team building activities, because as a medical assistant, you are part of a team. You're never working alone or by yourself in a computer in a room. You're always around people. You're caring for your patients. You're working with the provider, with the doctor, with the front office. And so this might look familiar to you. This is the Marshmallow Challenge. There's different variations of it, but we get to do this. They're timed, but they have to work together, right, to achieve an end goal. And so, we have a lot of fun with it. We do a lot of learning activities, but, while having fun as well. And then just some of our partners we've mentioned before. So Adelante is one of our partners that we and when I say partners, these are our externship sites. These are the clinics, the hospitals that accept our students. They take them kind of under their wing, and then they let them practice what they've learned in the classroom, and they also teach them. They're also still learning, right? You're still a student while on externship. So Adelante, Arizona Cardiology Group, Banner, FastMed Urgent Care, Honor Health Group, IMS, Mayo Clinic is another one of our partners, which we're really proud of and excited, and Phoenix Children's Hospital as well. So, and these are just a few of our partners. We have different specialties. We have dermatology, pulmonology, but these are just some that we just decided to highlight. But if you're interested in a field and, you're always wanted to work with children, pediatrics might be a good site for you, right? And so we have those partners. And so overall, what the students are going to learn, you're going to learn the foundations, right? The basic skills of front office, back office. The course is about 9 months long. It takes 830 clock hours to complete. We do have the course, the program runs from Monday through Thursday, 8:30 a.m. to 1:30 p.m. That's the day. And then in the evening, 6 p.m. to 10 p.m. All right, the estimated cost of the program is about $5,096, and for the students who qualify, financial aid is available. Okay. And that is the end of my presentation. I don't know if anybody has any questions. I know somebody was going to be monitoring the chat box.
Hey, Angie, yeah, so no questions currently, but we'll give them a couple of seconds because there tends to be like a 15 to 45 second delay. So We'll give them a second, and then in about a minute, if there are no questions, I'll let you continue.
Okay, sounds good. And one of the things, maybe while people are thinking of questions or we're waiting for any of those questions to come in, one of the things I did want to share that a lot of the students that come into the program in the beginning, you know, they're interested in healthcare, but they're just not sure what they want to do. They want to possibly be nurses or physicians, and so they use the program as a stepping stone. And I think that it really does serve as a really good foundation. It gives the learner an idea of, like, you know, what they really like about medicine, what specialty they want to focus on. It's a small investment in time and money, so you know it is a good way to start. If you're not quite sure, you know, you want to do something in healthcare but you don't know, I encourage you to look into the medical assistant program.
Okay, I just dumped the first question in there, Angie.
Okay. Sorry, and I'm trying to find the chat, or I can accept there.
I can read it to you, Angie. It says,
Thank
what is
you.
your
Yeah, I
favorite
could-
part? It says, what is your favorite part of what you did as a medical assistant?
Well, I have a lot of favorite, you know, my favorite thing was being able to, okay, this is going to sound funny. So I love being able to, you know, feel like I did something for somebody, that I was able to help someone feel better at the end of the day. And one of the things that I could do as a medical assistant that really, really made me feel that way every time was ear lavages. I don't know if you know what an ear lavage is. An ear lavage, or if you've ever had one, but when somebody gets a lot of earwax impacted in their ear, and sometimes they can't hear, or it hurts, or it's causing discomfort. When you remove whatever is impacting the ear, the patient feels instant relief, and they're so thankful and so grateful that you were able to help them. And so it's kind of a grody thing to do, and you know, sometimes it can be a little icky, but that was one of my favorite things to do, because patients felt immediately after it was done, they felt better, they were relieved, and they were so thankful. And so I'm like, oh, I did something really good for someone today. So that was one of the things that I liked. I enjoyed kind of like the gross things. I liked assisting in abscess, lancing of abscesses. I don't know, I'm weird, I know. So I liked helping and assisting the provider when they were doing small office surgical procedures. I liked being in the room. I liked being in the room, not just because of the kind of the gross factor, but also because I was able, you know, always very professional, of course, you know, but I was also able to be there for the patient, you know, and be able to comfort the patient and calm the patient while undergoing a procedure like that. So those are kind of my favorite things.
Angie, could you please take a moment to explain the difference between clock and credit hour?
Yes, so we are a clock hour program, and so clock hours is done. It doesn't necessarily, you don't earn credits for the program. However, we have a partnership with Phoenix College, and so if you complete our program, our clock hour program, and you want to continue to perhaps get an associate's degree, you can transfer. And this is the only instance that, because we have a partnership with Phoenix College, you can transfer our clock hours to Phoenix College and earn a degree. So the difference is that with credit, you can they can transfer to university, they can transfer to other colleges typically. With our program, the end completion is not necessarily an associate's degree unless you plan on transferring over to Phoenix College. You get a certificate of completion. And that allows you to continue to work in the field as a medical assistant. Hopefully I answered the question. Maybe Arnold might have an additional information to kind of help me out there.
Oh yeah, I think you answered it pretty well, Angie. I think you covered that one. There is a second question that came in. It says, is it easy to transition from medical assisting to other medical roles if you want to change roles later?
Yes, I want to say that it is. It all depends on the individual, right? And what your goals are. As I mentioned earlier, a lot of people who join the program, they join it because they are interested in healthcare, but they don't know what they want to do, right? The nice thing about the program is not only is it a short program, is it, typically costs less than other programs, but you get to know the field, right? You get to learn about it. And so you might decide that, oh, I thought I wanted to be an RN, but now that we are reading on this chapter and learning a little bit more about this, I want to be an ultrasound tech. Or I've had students who have gone on to be physician assistants. I have a student right now who was in my class 3 years ago, and she completed the program. She went on to work. She was working for Next Care Urgent Care. That was where she did her externship, and they hired her. So she stayed working with them. And while she was working with Next Care, she went to nursing school, and she's getting ready to be done with the nursing program. So she's going to be an RN. And so that's just a couple of stories of other students who have gone on to, continuing their education and gaining other roles and experiences. So I really, as much as I want to say yes, it's easy, it depends on what your goals are. What do you want to do? What did you decide later on that you wanted to do? One of the things, and I'll share a personal story. The medical assistant program was supposed to be my stepping stone. And I was going to go on to be a nurse. But I really enjoyed it. I really liked what I did. I worked at really cool places, and I built really great relationships that I stayed a little bit longer. Now, however, now I'm teaching, right? So later on, eventually, I went on to teach the program. So there's so much that you can do with a medical assistant, right? There's so many other things that you can kind of branch out to. It really just depends on what you want to do. What are your goals? Yeah.
Thank you so much, Angie. And then another question came in. These are really good questions. So what does a normal day look like as a medical assistant?
Well, if you're working, depending on the specialty, right? So if you, gosh, you can be in so many different places. But typically, medical assistant roles are to open the clinic, right? So you prepare the clinic for the patient. So before you even start seeing patients, the MA is there getting the clinic ready, making sure that, from the front office that we have enough paper for people to check in, that we have the supplies in the rooms, that we have all the strips, all the gauzes, everything that you're going to need for the day so that the clinic can run smooth, right? So I don't know if you've ever been at your doctor's office and maybe you've waited 3 hours, something's happened, right? So there was some kind of disconnect in the back. Maybe there was somebody who called off sick or there's an emergency. But typically the MA's job is to make sure that clinic runs smooth. You have a lot of responsibilities, you do a lot. So not only are you preparing for the clinic, but throughout the day, you're kind of staying ahead of the game, making sure that you're staying fully stocked, that you're bringing in patients, you're taking their vitals, that you're giving report to the provider about a patient. If there's an emergency, that you're communicating with the provider, And I say provider because it can be a doctor, it can be a PA. We have different providers. And so that you're communicating, letting somebody know, hey, we have a patient in room 3 who has, who's complaining of chest pain and shortness of breath. That's an emergency. That can be life-threatening, right? That can be something between life and death. So you're that connection. So not only do you have the duties of making sure that the clinic is running smoothly, but you're providing patient care as well. And you do that by taking their chief complaint, their vitals, communicating with the provider. Sometimes the provider may say, yeah, this is an emergency. We need to call 911. So you're that link, right, to providing the best possible care to the patient. So throughout the day, you're doing duties such as that. And then at the end of the day, preparing the clinic for the next day. So making sure everything's clean, neat, the exam rooms have been sanitized and disinfected. And that's throughout the day. But at the end of the day, that's the last thing that we do as well. That the exam rooms are cleaned, sanitized, the instruments that we're using on patients, that everything is being properly maintained, and preparing for the next day. And so that's just kind of like a quick overall, but there's so much more, right? And one of the things, since I'm kind of thinking about it, it might be going off a little bit, is that you don't necessarily, if you've gone through the program, you don't necessarily have to work as a medical assistant. So in my experience, I worked in correctional health. I wasn't a medical assistant, but I was able to work in the setting because of my training as a medical assistant. I worked as a correctional health tech, and I was able to work in the jail and provide patient care for the inmates. And so, again, so don't just get stuck on the title medical assistant, because you can work. And I think that might kind of go back to answering someone else's questions prior to, was, how is it to transition? You can work in other roles, but you can perform those roles because of your training as a medical assistant.
This is awesome. Those are all the questions that we currently have. We'll give one more look. Great questions, super insightful answers. Thank you so much for that. But I think that wraps us up on the question part.
Awesome. Yes, thank you. Those were really good questions. I appreciate it. We're going to leave our information with you. So if anybody has any other questions later, maybe you can forward those to us, and we'll be happy to help them and answer any of the questions that they may have.
Awesome. We definitely will. We're going to have a spot for resources for all of these to follow up. So that would be great.
Great. Thank you so much.
Okay, so